everyone, Dr. Jen here with a quick medical minute. You may know and you may have seen on the news that we are seeing an increase in respiratory infections in kids. And that is pretty typical, particularly a similar pattern to what we saw pre-pandemic, right? Before everyone was doing all of the social distancing and more consistent mask wearing, where we had less of these sort of surges in respiratory infections because of those measures. Now we're starting to see more typical patterns of infections. And particularly any respiratory infection right now is potentially on the rise, everything from the common cold to a virus called RSV, to even walking pneumonia that's caused by a bacteria called Mycoplasma pneumoniae. What's important, I think, for all of us parents to know is that these are on the rise, and in the wintertime we need to take extra precautions to help prevent the spread of these infections, both to each other and those that are more vulnerable, like very young infants and older adults. So how do we prevent it? Number one, good hand washing, as always. Number two, staying away from others when you are sick, or wearing a mask if you're in a poorly ventilated area and around a lot of people. Obviously, if you have no choice to be around others when sick, wearing a mask also helps to protect spread. And then third, get your vaccines for those things that are vaccine preventable. For example, there is a vaccination. There are 3 vaccinations actually available for adults, older adults, 60 and above, or higher risk adults, 50 and above, which I now fall into that risk category, to help prevent against RSV. And of course, we also have a treatment for babies called monoclonal antibodies, which helps to prevent infection for RSV in babies. The reason we worry about babies and RSV is that it actually can be pretty life-threatening and severe, particularly for babies with other medical conditions like heart disease, babies who were premature. RSV as a virus can lead to hospitalization, stopping to breathe, and can be even life-threatening in severe cases. So we want to definitely protect those people that are more vulnerable for major complications from that virus. And you and I, RSV might just be a common cold. So just be aware if you're sick to try and avoid spreading it to those that are most vulnerable. The other thing that we're seeing a rise in right now is that walking pneumonia you probably heard about, which typically surges in the wintertime every 4 to 7 years. This might be our year to have a bigger increase. It could happen anytime, but of course we're seeing a rise right now in certain areas of the country. Mycoplasma pneumoniae is a type of pneumonia. For most people, it can result in just a common cold, but in some it can go into more deeply into the lungs and cause true pneumonia, which typically presents with signs like coughing for more than 7 days. You can have fever. You can have, kids or adults suffer from lethargy, and even difficulty breathing. So if you have a cough that lasts more than 7 days, or if you have signs of lethargy or difficulty breathing at any time, make sure you seek medical attention right away. Walking pneumonia in and of itself does require antibiotics versus other respiratory infections that are caused by viruses where antibiotics don't help, and we just need to give it time and supportive care. So be on the lookout. Never hesitate to call your pediatrician or your doctor if you're an adult if you have questions. But most of these viruses and infections in the wintertime, while they are not fun, can be managed at home unless you have some of those more concerning symptoms. So be well. Again, practice hand hygiene, get your vaccines, and avoid being around others when sick. That's all it is. That's all I have today for my medical minute. Good luck, be well, and be safe.